Hi, I'm Tania from Sage Institute of Aged Care, and today we're going to demonstrate how to use a slide sheet. We use a slide sheet when the resident can't move themselves around the bed. The slide sheet is made from a parachute type of material that actually slides over itself when you fold it over. That's where the name slide sheet comes from. And it's designed to make it easier to move a resident around a bed without us hurting ourselves. So today we're going to use a large slide sheet that needs to be folded over on top of itself. When you fold the slide sheet, you need to make sure that the opening faces the direction that you want to turn the person. So today we've got our resident that we need to roll from her back onto her side. We need a second person to do this type of movement, and I have my helper today, Jackie. How are we going there, Anne-Marie? Are you ready to go?
I am.
Fantastic. So what we're going to do to move the resident is bend up her knee if she's capable of doing that. And that helps with the motion of moving the person. So it's a simple pivot using the hip and the shoulder movement. While she's on her side, Jackie's going to hold onto her and keep her safe and secure. In the meantime, I'm sliding this slide sheet underneath Anne-Marie so that it is nice and flat and ready to use. Are we right to turn her over? Thank you. We're going to put Anne-Marie's leg back down and bend up the other one and pivot her this way. So while Jackie's pulling the sheet out, I'm holding on to my resident, making sure she's safe and secure and doesn't feel like she's going to fall out of the bed. Okay, now the height of the bed is really important because we need to have it at a height where we're not going to injure ourselves and hurt our backs. And when you're working with people of two different heights, sometimes it's really a challenge to find the point where it is a good spot for both of you. But when you work together in a team, then those things work out. We're going to grab hold of the top part of the slide sheet, not the bottom part, because we're going to use the sliding movement to move our resident. If we were to grab both bits, we would be lifting our resident, and that's not the intention of using the slide sheet. When we grab hold of the slide sheet, we need to grab close to the person. I like to actually physically make contact with my resident and know that I'm as close as possible for the movement. I also try and position myself where my back is straight, I'm taking the weight through my legs, and that my arms are doing the movement, not my back. On the count of 3, we're going to turn our resident. So we're going to move her from her back onto her left side and place her in the middle of the bed. Are you ready, Jackie?
I'm ready.
Okay, on the count of 3, 1, 2, 3. So we just move and pull the sheet up here. So I'm still here with the resident. She is on her side. She is comfortable and safe. To remove the slide sheet, I grab the bottom part, have you got hold of her? And pull that out through this way, and then that way we don't need to remove the resident and change her positioning. And the slide sheet is out. The resident is on their side where we need them to be, and we just make sure that they are in the best possible position, and we lower the bed back down to the height appropriate for our resident before we leave our resident.